Good evening, students. I hope everybody can listen to me. Uh, Students, please mute your mic and you can give me heads up if everybody can listen to me. Am I audible? Okay, let's just start. So I'm gonna uh, tell something about operative dentistry today, which include dental caries, plus the instruments, hand cutting instruments, or the other instruments that we use in our clinics, plus the materials and the restoration, the cavity preparation, and cavity classification. These things are included under the operative dentistry. So this is a very small topic which I have chosen for today. So let's just know a little bit about operative dentistry. What is it exactly? As it's clear from the name. So we've been studying this definition since our uh, second year of BDS, that operative dentistry is the art and science of the diagnosis, treatment, and prognosis of defects of teeth that do not require full coverage restorations for correction. So we all know the basics of operative dentistry. What do we do in dental office, in dental clinic? We whenever patient enters the clinic, we diagnose, we make a treatment plan, and then we know the prognosis according to the condition of the teeth of that patient. So according to that, we make a treatment plan and we treat those defects, those teeth defects that do not require full coverage restorations for correction. So such treatment should result in the restoration of proper tooth form, function, and aesthetics while maintaining the physiologic integrity of the teeth in harmonious relationship with the adjacent hard and soft tissues, all of which should enhance the general health and welfare of the patient. So these are the basic things that we've been studying for 5 years of our BDS degree, that we restore a tooth so that it maintains the integrity of the tooth itself and also the integrity of the adjacent hard and soft tissues, that is the gingiva and the bone, alveolar bone. So that it should enhance the treatment, the restoration should enhance the general health and welfare of the patient. So operative dentistry, in general, if we talk about operative dentistry, it includes so much stuff that we cannot count. But on a small note, it includes the use of lasers, improvements in composite, adhesive systems, castable ceramics, and computer generated restorations. If there is any question while I'm giving the lecture, please, everybody is welcome to ask any question. So, as I have already discussed, that operative dentistry itself, it's a very small topic which includes about dental caries, diagnosis and examination, and cavity classification, the types of cavities and the cavity preparations. Then about the hand instruments, operative instruments, hand cutting instruments, and about the restorations, dental materials like and the properties of cements, bases, liners, and temporary restorations. So today I'm gonna discuss like half of the operative dentistry, that is about dental caries, its etiology, the organisms responsible for the dental caries, and the pathogenesis, examination and diagnosis, clinical examination, caries detectors, radiographic evaluation, cavity preparation, and cavity classification, the instruments and the restorations plus the materials. I will discuss about them in our next class. So let's begin with the dental caries. So we know, everybody know, whoever has done BDS, everybody know what is dental caries. Like we've been studying about this term since day one we joined the dental school. So I hope everybody know about the reference books that we refer for the preparation of NBDE exam for America. So there's a book called First Aid. According to the book First Aid, it defines dental caries as the most common chronic disease in the world, an infectious microbiologic disease of the teeth that results in localized demineralization and destruction of the calcified tissues, leading to the loss of tooth structure. So we know all about this definition. So it's a basic definition that we've been studying these years. So then, according to Kaplan's, there's another reference book which is Kaplan. So it defines caries as an infectious bacterial disease which is caused by keriogenic plaque formation on the tooth that results in demineralization of the tooth, sometimes requiring restorative intervention and even extraction. So it tells about a little bit of treatment plan about the caries. It tells about etiology, a little bit about etiology, and a little bit about its treatment plan. That uh, caries is caused by keriogenic plaque formation on the tooth. The plaque that is formed on the tooth, which has keriogenic organisms, that results in the breakdown of enamel at pH 5.5 or less, which is acidic pH, which initiate the breakdown of enamel. So eventually, which leads us to either provide restorative intervention or even extraction if the prognosis is worst. So a little bit about etiology. So what happens is carious lesions occur when a mass of bacteria adhere to the tooth surface. And what is that mass? That mass is dental plaque. So the plaque bacteria then feast on refined carbohydrates. What are refined carbohydrates? Obviously sugars. So the plaque bacteria feast on these sugars and metabolize those sugars and produce acid byproducts. And what is that acid? Lactic acid. The acid then lowers the pH of plaque, which is adherent to the tooth, and the critical pH is reached at which demineralization of the adjacent tooth takes place. So the critical pH, as I have told earlier, that it's 5.5 is the critical pH, and they say that some sodas have a pH of 3.5. So there's some. This is some extra information just to give an idea that sometimes not sometimes, but most of the times, obviously everybody know that what we are reading in books, and that we have to remember every theory and every definition or everything written in the books, but not everybody, especially not the international students, they don't know about the edible products or the brands that are being used in America. So not to demotivate, but one should know about the brands of the edible products or things that have connection, a link with dentistry. That these edible